Hello and welcome to our video. As we age, our bodies and minds go through many changes. But what are the signs that your health is declining after age 60? And how can you stay on top of it? In this video, we'll take a closer look at some of the most common signs of aging that can affect your mobility, memory, and overall health. Understanding these changes is key to maintaining a healthy and active life. So whether you're experiencing some of these shifts or just want to learn more, keep watching. Let's dive in. Changes in mobility and endurance after age 60. As we grow older, our bodies naturally start to change, and one of the first things we notice is how our ability to move and keep up with our usual activities begins to shift. After the age of 60, mobility becomes an important focus. It's something that might not seem noticeable at first, but when you start to feel that everyday tasks are getting harder, it could be a sign that your health is starting to change. Let's look at some common signs related to your mobility and endurance and what they can tell you about your overall health as you age. Decreased flexibility and joint stiffness. When you hit your 60s, you might start noticing that your joints feel a little stiffer, especially in the mornings or after sitting for a while. This is quite common. Over time, the cartilage in your joints naturally wears down, which can cause discomfort and limit your range of motion. Tasks like bending down, reaching up, or even twisting your body might start to feel a little more challenging. Joint stiffness and discomfort could be signs of conditions like osteoarthritis, which many people develop as they age. It's also normal to feel less flexible, making it harder to stretch or bend like you used to. If these changes are affecting your ability to do everyday tasks, it's a good idea to pay attention and seek ways to manage it, whether through exercise, stretching, or medical help. Muscle weakness and reduced strength. Another thing that happens after 60 is that your muscles may not feel as strong as they once did. As we age, muscle mass naturally decreases, and this process is called sarcopenia. You might find that lifting heavy objects or even carrying groceries becomes more difficult. Simple tasks like getting up from a chair or lifting something overhead might require more effort than they used to. This loss of strength can make you feel weaker overall, and it can also increase the risk of falls or injuries. But the good news is that strength training, even light exercises like resistance bands or bodyweight exercises, can help maintain your muscle strength. It's important to keep moving and stay active to slow down this natural decline. Reduced endurance and increased fatigue. After age 60, many people start feeling more fatigued than they used to. What once felt like a simple walk around the block might leave you feeling winded or out of breath. Your heart and lungs, like the rest of your body, aren't working as efficiently as they did when you were younger. This doesn't mean something is seriously wrong, but it's a normal part of aging. Your stamina may not be what it was before, and recovery after physical activity might take a little longer. You might also notice that even simple activities, like doing the dishes or climbing a flight of stairs, feel more exhausting than usual. Balance issues and risk of falls. As you get older, you may also experience some changes in balance. This can happen because your muscles weaken, your joints stiffen, and your coordination decreases. All of these factors make you more prone to losing your balance and possibly falling. You might notice that you're more likely to trip or stumble, especially on uneven surfaces or in low-light environments. Falls can be dangerous for older adults, leading to injuries like sprains, fractures, or worse. So it's important to pay attention to your balance. Regular exercise like walking, yoga, or even balance training can help you improve your stability and prevent falls. Slower walking speed and less physical activity. Another common sign of aging is a slower walking speed. You might start to notice that you're not walking as quickly as you used to, and even walking at a normal pace might seem more difficult. This is completely natural as we age, but it can be frustrating. A slower pace often happens because of weaker muscles, stiffer joints, or reduced cardiovascular health. If you find yourself walking slower, it might be harder to keep up with others when you're out and about, or even do the things you enjoy. But this doesn't mean you're stuck. Staying active can help you improve your walking speed and stamina over time. Poor posture and back pain, along with changes in your ability to move, you might start noticing changes in your posture as well. After 60, many people experience a slumped or rounded posture, especially in the back and shoulders. This can happen because the muscles that support your spine weaken and lose flexibility. Poor posture doesn't just affect how you look. It can also cause pain in your back, neck, and shoulders. Over time, it can even affect your breathing and digestion. If you notice your posture starting to decline, working on strengthening your core muscles and stretching regularly can help improve it. Impact on mental health and quality of life. All of these physical changes can have an impact on your mental health as well. It's easy to feel frustrated or discouraged when everyday tasks become harder, and it can lead to feelings of sadness or anxiety. Losing independence, even in small ways, can be emotionally challenging. Additionally, when you're less mobile, it may become more difficult to stay socially active, which can lead to feelings of isolation. But remember, you're not alone in this. Many people experience these changes, and staying proactive about your health can help you maintain your quality of life. What can you do about it? The good news is, there's a lot you can do to slow down the effects of aging on your mobility. Staying active, even with simple exercises like walking, swimming, or stretching, can help maintain your flexibility, strength, and endurance. Strength training in particular is key to fighting muscle loss and keeping your muscles strong. Eating a healthy diet with plenty of nutrients for your bones and muscles is just as important. Calcium, vitamin D, and protein are all essential for maintaining strength and mobility. And don't forget, talking to your doctor can help you identify any underlying issues and get the right treatment to stay healthy. Changes in memory and cognitive function. After age 60, as we age, it's not just our bodies that change, our minds do too. After age 60, many people begin to notice some shifts in memory and cognitive abilities. While these changes are often a normal part of the aging process, they can sometimes be concerning. It's important to understand what's happening in your brain as you get older and recognize when these changes might indicate something more serious. Let's explore some common changes in memory and cognitive function after 60 and what they might mean for your health. 1. Memory lapses and forgetfulness. One of the most noticeable signs of aging is memory lapses. You may find that you forget things more often, like where you put your keys, someone's name, or why you walked into a room. While this can be frustrating, it's often a natural part of aging. The brain's ability to store and retrieve information becomes slower over time, and short-term memory in particular can be affected. Forgetting names or dates, or needing to take a little extra time to recall details, doesn't necessarily mean you're experiencing something serious. However, if you find that memory lapses are affecting your ability to complete everyday tasks or causing significant anxiety, it's worth talking to your doctor. 2. Difficulty in concentration. Another common change as we age is difficulty in maintaining focus. You might find it harder to concentrate on a task for extended periods of time, whether it's reading a book, watching a movie, or even completing work tasks. This can be linked to changes in brain function, where the brain may take longer to process and organize information. Many people experience this as they get older, but it's important to recognize if the lack of concentration is interfering with daily life. It could also be a sign of other underlying conditions, like sleep disturbances, stress, or depression, which are also common as we age. 3. Slower processing speed. Along with concentration difficulties, another change that many people notice after 60 is a slower processing speed. This means that it might take a little longer for your brain to process information or make decisions. For example, you may find yourself taking a little more time to follow a conversation, respond to questions, or solve a problem. Slower processing speed is completely normal as the brain's neural connections become less efficient over time. However, if you find that it's affecting your ability to perform daily tasks or causing you to feel confused or overwhelmed, it may be worth investigating further. 4. Trouble with multitasking. Multitasking can become more difficult after 60, and that's because the brain's ability to handle multiple tasks at once starts to decline. You might find it harder to juggle activities, like cooking dinner while talking on the phone, or switching between different tasks at work or home. This is because the brain's executive functions, which are responsible for tasks like planning, decision-making, and managing multiple actions at once, tend to weaken with age. It's not that older adults can't focus, they may just need more time to complete tasks one at a time. 5. Difficulty with word recall. As we age, it's not uncommon to experience moments when you can't find the right word during a conversation. You might know what you want to say, but struggle to retrieve the word from memory. This phenomenon is often referred to as a tip-of-the-tongue moment, and while it can be frustrating, it's generally harmless. The brain's language centers may process words more slowly, which can lead to brief lapses in recalling specific terms. This can also happen if you're trying to remember something from long-term memory, especially if you haven't thought about it in a while. Again, while these moments are typical, if you notice more frequent or persistent issues with language or communication, it's worth discussing with your healthcare provider. 6. Changes in problem-solving and decision-making. Another cognitive shift you may notice after 60 is a change in how you approach problem-solving and decision-making. You might find yourself taking longer to make decisions or struggling with more complex tasks that require detailed thinking. This may be because the brain's ability to process new information and make rapid decisions declines with age. Your decision-making process might become more cautious or slower, and you might prefer relying on past experience and routines rather than making new, risky choices. However, this doesn't mean you're losing your ability to think critically. It's just a sign that your brain may prefer more structured or familiar approaches, which is perfectly normal. 7. Decreased ability to learn new information. As we age, our brains become less efficient at forming new memories and learning new information. You may find it harder to remember new things, whether it's a new skill, a new person's name, or even a new technology. The decline in memory and learning capacity is part of the normal aging process, but it can be frustrating. This doesn't mean that learning is impossible after age 60. In fact, many older adults find that they can still learn and adapt to new things, but it may take a little more time and effort. Engaging in activities that challenge the brain, such as puzzles, reading, or learning a new hobby, can help keep your brain sharp and improve your ability to retain new information. 8. Mood changes and mental health concerns. Mental health issues, including anxiety and depression, can also impact cognitive function. If you're experiencing significant mood swings or feelings of sadness, these could affect your memory, concentration, and decision-making abilities. The emotional toll of aging, such as dealing with loss or a changing lifestyle, can have a direct impact on cognitive function. Additionally, mental health conditions like depression and anxiety are more common among older adults and can contribute to cognitive decline. If you're noticing changes in your mood, it's important to speak with a healthcare provider who can help you address these issues and provide appropriate treatment. 9. When to seek medical help. While many changes in memory and cognitive function are normal after age 60, it's essential to keep track of your mental health and cognitive abilities. If you begin to notice that memory lapses, confusion, or difficulty in concentrating are becoming more frequent or severe, it may be time to consult with a healthcare professional. Conditions like Alzheimer's disease, dementia, and other neurodegenerative disorders can lead to significant changes in memory and cognition, and early intervention can make a big difference in managing these conditions. Regular checkups and discussing any cognitive changes with your doctor can help you stay on top of your brain health. Conclusion: changes in memory and cognitive function are a normal part of aging. While these changes can be frustrating, they are typically manageable with the right strategies, such as maintaining an active brain, engaging in physical exercise, and focusing on mental health. However, it's important to remain vigilant and seek professional advice if the changes become significant or interfere with daily life. The more you understand about the aging process and how it affects your mind, the better prepared you'll be to maintain a healthy, active, and fulfilling life. Changes in overall health after age 60. As we age, it's not just our ability to move or think that changes. Our overall health also experiences some significant shifts. After age 60, the body becomes more vulnerable to various conditions, and its natural resilience starts to decline. It's crucial to understand these changes so that you can take proactive steps to maintain your health and prevent potential problems from escalating. Let's explore some of the most common changes in overall health after age 60 and how they may impact your daily life. 1. Weakened immune system. One of the most significant changes that occur after age 60 is a weakening of the immune system. As you age, your immune system becomes less effective at fighting off infections and diseases. This means you may find that you catch colds or infections more easily than you did when you were younger. What used to be a mild illness could take longer to recover from, and your body may not fight off infections as quickly as before. The decline in immune function is a natural part of the aging process, but you can help strengthen your immune system by eating a healthy diet rich in vitamins and minerals, staying active, getting enough sleep, and managing stress levels. 2. Increased risk of chronic conditions. As you reach your 60s, the risk of developing chronic conditions such as high blood pressure, diabetes, and heart disease increases. These conditions are more common as people age, and they can have a significant impact on your overall health and quality of life. High blood pressure, for example, can lead to heart disease and stroke if not properly managed. Similarly, diabetes can affect your organs and lead to complications if left untreated. Regular health screenings are essential for identifying these conditions early. The earlier you catch them, the easier it is to manage and reduce the risk of complications. Staying active, eating a balanced diet, and taking medications as prescribed are key factors in managing chronic conditions. 3. Decreased bone density. Another important change that occurs after age 60 is a decrease in bone density, which can lead to osteoporosis, a condition where the bones become brittle and fragile. This condition makes fractures and bone breaks more likely, even with minor falls or injuries. Osteoporosis is particularly common in postmenopausal women due to a decrease in estrogen levels, but men can also develop it as they age. To prevent or manage osteoporosis, it's important to maintain a diet rich in calcium and vitamin D, as well as engage in weight-bearing exercises like walking, jogging, or strength training. These activities help strengthen bones and improve bone density, which is crucial for maintaining overall mobility and preventing fractures. 4. Reduced organ function. As we age, the function of our organs naturally declines. The heart, kidneys, and liver in particular experience some of the most noticeable changes. The heart may become less efficient at pumping blood, leading to an increased risk of heart disease or heart failure. The kidneys may not filter blood as effectively, and the liver may struggle to detoxify the body in the way it once did. Taking care of your heart and other organs is essential for maintaining overall health. Regular exercise, a low-sodium and low-fat diet, and avoiding alcohol or smoking can all help support healthy organ function. 5. Changes in sleep patterns. As people age, they often experience changes in their sleep patterns. It's common for older adults to sleep less deeply and to wake up more frequently throughout the night. You may find yourself feeling tired during the day or needing naps to compensate for disrupted sleep at night. Sleep disturbances can be linked to various health problems such as arthritis, respiratory issues, or even depression. It's important to address sleep issues early by maintaining a regular sleep schedule, creating a relaxing bedtime routine, and managing any underlying health problems that may be affecting your sleep. 6. Digestive changes. Another common change after age 60 is a slowdown in digestive function. The digestive system becomes less efficient as we age, which can lead to issues such as constipation, acid reflux, and bloating. The muscles in the digestive tract may become weaker, and the stomach may produce less acid, which can affect the breakdown and absorption of food. Eating a high-fiber diet with plenty of fruits, vegetables, and whole grains can help improve digestion and prevent constipation. Staying hydrated and exercising regularly can also support a healthy digestive system. 7. Decreased skin elasticity and wrinkles. As you age, your skin loses some of its elasticity and begins to show signs of aging. Wrinkles, age spots, and sagging skin become more noticeable. This happens because the production of collagen and elastin in the skin decreases, leading to a loss of firmness and flexibility. While these changes are natural, they can affect your self-esteem and how you feel about your appearance. Taking care of your skin by moisturizing regularly, protecting it from the sun, and maintaining a healthy diet can help reduce the visible effects of aging. There are also cosmetic treatments available that can help reduce wrinkles or age spots if desired. 8. Mental health and emotional well-being. Mental health becomes an even more important aspect of overall health after age 60. Many older adults experience feelings of sadness, loneliness, or even depression, especially if they are no longer as active or social as they once were. The loss of a loved one, changes in living arrangements, or dealing with health problems can all take a toll on mental health. It's essential to prioritize mental well-being by staying socially connected, seeking professional help when needed, and engaging in activities that promote a positive mindset such as exercise, hobbies, or volunteering. 9. Decreased mobility and flexibility. As mentioned earlier, mobility and flexibility tend to decline with age. Stiffness in the joints, decreased muscle mass, and reduced endurance can make it harder to perform activities that were once easy, such as walking, climbing stairs, or carrying groceries. This decrease in mobility can impact your independence and overall quality of life. Engaging in regular physical activity, including stretching, walking, or strength training, is crucial for maintaining mobility and flexibility. Staying active not only helps improve physical function, but also has positive effects on mental and emotional health. 10. When to seek medical advice. While many of these changes are a natural part of aging, it's important to recognize when they may indicate a more serious issue. If you experience significant pain, unexplainable weight loss, severe fatigue, or any changes in your ability to perform daily tasks, it's crucial to seek medical advice. Early detection and intervention can help prevent further complications and improve overall health outcomes. Conclusion: the changes that occur in overall health after age 60 are a natural part of the aging process. While these changes can sometimes feel overwhelming, staying proactive about your health can help you maintain a high quality of life. Regular medical checkups, staying physically active, eating a balanced diet, and prioritizing mental health are all key factors in navigating these changes successfully. By staying informed and taking care of yourself, you can enjoy a healthy, active, and fulfilling life for years to come.